So we're wanting, as a parent of a child with biliary atresia, we're obviously wanting to hope that Kasai lasts as long as possible, delay needing a transplantation until she's bigger, stronger, and all those things. So is there anything that we can do as parents of a child with biliary atresia to improve her quality of life, or essentially encourage her to keep her native liver as long as possible? So I know we've talked about nutrition and presenting her to the hospital as soon as possible when there's any signs of ascending cholangitis.
Yep.
Is there anything else that we can do?
So ensuring that the little one is growing well, protecting in terms of the preventative antibiotics for cholangitis and treating appropriately, responding appropriately with fever or a change in the situation. And in some cases we use medicines that could help in terms of helping to drain and keep things moving through the liver. There are other medicines that are coming and being assessed that may have a role in terms of helping to get drainage or to keep drainage early on, but they're not available routinely. I think I can't think of anything else particular from a parent's perspective, in addition to those things we've talked about. It's being aware and looking for changes and responding appropriately.
Making sure she's growing and feeding her when she needs to.
Yep.
Cool. I think as a parent with a child with a chronic condition, you try to do everything that you possibly can that's in our control, because there's so many things that are out of our control. So I think that was a question we would ask ourselves often, to see if there was anything we could do to, optimize her future. So,
and I guess if I can just interrupt, so
sure.
one of the things, and you may be able to add to this, is when things are unclear and when there's uncertainty, sometimes that can make people more worried. And it's really important to be able to express those concerns, whether it's to the pediatrician or to the nurse that's linking in, or sometimes with a psychologist or social worker. There's other people that may be important in that team approach as well. So it's really important to be able to express and let people know of those concerns and worries. And whilst there may not be anything that parents could do differently, it's really important not to sort of stew and worry, but to keep the team involved.
I think as a parent in this situation, it was nice always being informed of what is happening and what could possibly happen, just so that we were kind of always aware of how the journey could go, because it could go in so many different ways. And I think having a really great medical team, which we did, always keeping us up to date of what those things are and not kind of keeping things hidden. I think there were times that we might have felt that we weren't being told the full picture, but in hindsight, that was probably how we felt at the time. In hindsight, it was because everything was a little, not uncertain, but we kind of just had to see how things played out. And I think just uncertainty over anything makes anyone quite anxious. But keeping up the information and the education was really helpful.